All right, what's up, Trailhead Family Chiropractic crew? I promised you a video a couple days ago, kind of breaking down the press conference with RFK and Trump and Dr. Oz, amongst other people, talking about Tylenol, vaccines, and autism. As I mentioned, I typically don't jump into politics. Um, Not that it's not important, but I choose to keep my business and my practice focused on healthcare. I know, that's what you guys trust us for, and while we can have other conversations on other things, I feel like it's important to make sure that everybody feels welcome in the practice. So that's why I typically don't address these type of pressers, but however, because this presser spoke specifically to the majority of our population in our practice, pregnant ladies, babies, and special needs populations, I felt like it was appropriate to just kind of digest the information from you, because that's the tough thing when it comes from a political source is how much can you trust it from one side of the pendulum to the other. Both have their agendas, and so I figured I'd make something that hopefully helps you see it from a purely healthcare perspective, and maybe some of the things that they're saying. Now, obviously, as a chiropractor, medications and vaccines are outside of my scope. I can't prescribe you a medication, and I can't give you or tell you not to get a vaccine. So really, I'm just going to try to help you understand the mechanisms for how these things work, why it might be related. That way you can make the best, most informed decision for you and your family. And that's ultimately all of our doctors' hopes at Trailhead Family Chiropractic. Whether you're one side or the other politically, one side or the other medically, our goal is that we want you to feel supported, and we want you to feel like you can ask questions, and we want you to feel safe and welcoming in our community. So that's the context. This is a huge video, and I don't want to make an hour-long response video to an hour-long press video. And so if you are interested in maybe some more long-form discussion on the biomechanics and biochemistry of it all, I am doing a presentation called The Gut-Brain Connection on September 30th. It's next Tuesday at 6:30 at our Marietta office, and it's free. And I break down a lot of this, honestly, and it's been a workshop that I've been doing for 10 years. And this is honestly why it's been hard to make this video. I thought I made one version already, and I've done 13 or 14 in my head. But I wanted to make one that's the most helpful for you without going into all the biomechanics. So first things first, let's talk about acetaminophen and the risk of autism, okay? So that's pretty much all you guys heard is don't take Tylenol. Don't take acetaminophen because there's a higher risk of autism. And if you aren't comfortable, tough it out because there's not many other good options during pregnancy. This is a bummer for a couple different reasons, because that gives the perspective that the only way to treat a body is with medication, which obviously for those of you that are part of our practice, we know isn't true. We view symptoms actually from a completely different lens, completely different perspective, where symptoms are actually messages from our consciousness from our subconsciousness to our consciousness to let us know that something is wrong. We view symptoms as maybe like a check engine light in your car, okay? If you are running low on gas and your gas light comes on and all you do is cover it up and ignore it, what's going to happen in due time is you're going to run out of gas and you're going to be stuck, right? So if you are pregnant and you are getting headaches and you do have pain, you are inflamed, you do get a fever or your kid gets a fever, just medicating it, in our opinion, really isn't a good root cause approach to begin with. So looking for alternative options to treat a fever and to treat pain and inflammation, in my opinion, we can go about it differently, okay? And that's what we do at our practice. From our perspective, the reason why you would have pain, the reason why you'd be inflamed is because your nervous system is stressed and has got to the point where it can't adapt to any more stressors. So pain is a message to your consciousness telling you that your body is stressed, a certain part of your body is stressed, and if you keep going, the problem is only going to get worse. So you should do something to help make it better. Headaches as well. Maybe you have a headache because you're dehydrated. Maybe you have a headache because you have low electrolytes or low minerals. Those are all things that you can easily try instead of taking a medication for fever. And same thing with pain. There's tons of modalities that you can use and practitioners that you can use. Acupuncture is safe during pregnancy. There's prenatal massage therapists. There's a float tank where you float in magnesium salts. And obviously there's prenatal chiropractic, which is our forte, something that is completely safe. We see hundreds, if not thousands, of ladies a year and walk them through their pregnancy. And then personally, I've walked my wife through 3 pregnancies, getting her adjusted all through her pregnancies. And the ladies that do get adjusted throughout their pregnancy often do report less pain, especially if they got chiropractic care through a second pregnancy versus the first one. They experience less pain, they experience a smoother labor and delivery process, and overall just less stress during their pregnancy. So if you are uncomfortable, you don't just have to tough it out. A prenatal physical therapist as well is also a great option, for you. So there are modalities, essential oils. Things are popping into my head as I am listing them. There are things that you can do to not only help feel better, but get to the root cause of why you're feeling that way. Okay. When we're talking about a fever, obviously something that can be a little bit more dangerous, especially in kids, but fevers aren't inherently danger. Fevers are actually a sign of a healthy functioning immune system. Okay, a fever is needed to help maybe burn off a bacteria or a virus. It's also used to leach calcium from the cells because calcium is needed in the metabolic processes in the immune system. So fevers can be a very healthy thing, and we don't always want to bring them down. We want to often support the fever. There's things that you can take. One supplement, if I'm remembering correctly from Standard Process, called Conjuplex, is really good. You can take a calcium supplement. You can take like a lukewarm if you're pregnant. Epsom salt bath. There's essential oils that are really helpful, and getting adjusted is something that will help your immune system through reducing stress in your nervous system. Okay. So those are all some alternative options that I want to bring out first. The second thing, maybe you're asking, okay, so why taking acetaminophen lead to a high risk in autism, and what study were they talking about? So they did a review of 56 different studies that had been done on acetaminophen and during in a prenatal exposure. Okay, so first of all, obviously the ones that had the highest exposure, I think it said greater than 28 days or in 2 trimesters, had the highest risk of these kids developing some neurodevelopmental disorder as kids when they're exposed in utero. The tricky thing with this is most people associate acetaminophen with Tylenol, and so if I didn't take any Tylenol, then you're at a lower risk, which is true. But what some people might not realize is that acetaminophen is also in some common allergy medications, as well as flu and cold medications as well. So let's say you take a few Tylenol for pain, you took a few Tylenol for allergies, or medication for allergies, and a few medications like Theraflu or Mucinex or whatnot while you're sick. So you may think you didn't expose yourself to a lot of medication, but through other medications, not just Tylenol, your body was exposed. Sudafed, is another one. And so that's something to think about, especially in your kid as well, because some of those drugs aren't super recommended during pregnancy. And so those might be things that your kid might be taking. Doesn't even have to be a young baby, it could be a toddler or whatnot. And so those are some other forms of acetaminophen that you could be exposing yourself to without really even knowing. So getting into the mechanism of why acetaminophen might be impactful. And I don't think it's like the one thing that would cause it. Anybody that knows anybody with autism, or any doctor that works with autism, knows that it's not just one thing. Usually it's a myriad of different factors that oftentimes we don't even know, but we can kind of troubleshoot and work at certain things within, whether it's the diet or the immune system or the nervous system, or brain or nutrient deficiencies, those sort of things that we can troubleshoot and work with to figure out what the root cause might be. But the mechanism of acetaminophen. So you have the active ingredient, which helps, reduce fever and reduce pain, okay? But there are things that are in these medications that the body wants to break down and detox, okay? So phase 1 of these detoxification is done in the liver, okay? And it's a process using cytochrome P450. Okay, it breaks it down and into a free radical. Okay, or it breaks it down, in the liver, so that way the body can detoxify it. Okay, and then you also have second stage detoxification, which I don't remember the initials of, but it's like NaClQ or like something like that. Okay, it breaks it down into this molecule, which is a free radical. Okay, now in order to neutralize this free radical, you need an antioxidant. Okay, and the antioxidant of choice that the body uses to detox the acetaminophen and whatnot is glutathione. Okay, and so this is why if you've been to any of my workshops, when I'm talking about perhaps a timeline of someone that gets diagnosed with neurodevelopmental disorder, acetaminophen is something that I list because when you are detoxing acetaminophen, either from one source or multiple different sources, or you've just been exposed to a lot of it, you can actually deplete your body's entire store of glutathione because it is an endogenous antioxidant. It's not really something that you can take that is super bioavailable. You can take the cofactors that help your body build it, but it's not super bioavailable when you take just straight glutathione, okay? When you lose glutathione, it's obviously one of the master antioxidants in the body, and it's one of the few antioxidants that actually crosses the blood-brain barrier. This is really important because if you have other toxins in your body that you are having a trouble, detoxing or whatnot, and you lose an antioxidant to the brain, that could leave the brain more exposed to it. And here's the key phrase. It could leave the brain more exposed to oxidative stress. And oxidative stress is what causes problems, okay? This is also interesting because the glutathione and link, is there, which is influencing the immune system. You also are looking at, maybe you give a Tylenol or acetaminophen after you got a vaccine. Okay, there's also things in the vaccine that the body is trying to detox. And so if it goes through that same detox pathway, but it doesn't have any glutathione because you used the glutathione to detox the Tylenol, then the toxins that are in the vaccine, such as adjuvants and preservatives, things that have to go in there in order to make it, in their terms, effective and shelf stable, but they are things that the body has to get rid of. Those toxins will then linger at the brainstem, okay? And there's a permeable blood-brain barrier at the brainstem because that's where a lot of our hormones and neurotransmitters are released from the hypothalamus and the brainstem and all that stuff, right in there, okay? So something else that's also important, and I know I've tried to plan this out, but I know I'm going deep here. Something else to think about. So we talked about the Tylenol exposure, primary, right? And then you talk about the secondary exposure through other drugs that might have acetaminophen in it, okay? And then you have a tertiary issue, or they're all really, really one, but for sake of organization, you have this problem of eating foods that have glyphosate, okay? It's darn near, unavoidable. Even if you eat primarily organic, we've probably been exposed to it. It's in our, the rainwater, it's all over the place, okay? And so this is a bummer because glyphosate actually inhibits cytochrome P450. So if you have an inhibited cytochrome P450, now you're losing phase 1 detoxification, and if you take Tylenol, you're losing phase 2 detoxification, leading to increased toxins in the brain and the brainstem. And this is further compounded if you have the MTHFR or any other genetic mutations, which also reduce your body's ability to detox by 20, 50, 75%. Okay? So this is why I think it's a part of the conversation, because it influences your body's capacity to detox and fight free radicals due to cytochrome P450 possibly being inhibited because of consumption of glyphosate. Ultimately, all this is leading to oxidative stress. And then if you're a kid, you had a stressful prenatal period, stressful labor and delivery, and the kid hasn't been adjusted or the mom hasn't been adjusted, and they have a nervous system that's stuck in a state of fight or flight, you add that on top of all these things. And then you add the other things that happen with kids as well. You have a lot of kids that get ear infections, and most of the time they're given a antibiotic, which destroys the gut biome, okay, which influences the gut-brain axis and the vagus nerve, which further puts the body into a state of fight or flight or stress. And so I think what you're looking at here is more tertiary downstream effects where you have all of these other things going on, the detoxification pathways, the epigenetic changes. You add in a vaccine or two, especially during the prenatal period with the DTaP and the flu shot, possibly COVID shot as well. So these are things that the body's already trying to detoxify, right? And then they found, there's a whole bunch of chemicals in the cord blood, as well as a study out of Quebec hospital that shows, over 200 chemicals in the cord blood, 80 some odd, being cancerous. So you're talking about a baby that's not necessarily, nothing has ever happened to it, but there's already things that the body is trying to process. And then you add one more thing on top of it. So for you pregnant ladies, I'm very sorry. There's a lot of things to analyze here. But I think, if you were going to take something away, what I would take away is search for alternatives and trying to get to root cause of your problems rather than just trying to treat them with medications. Research your vaccines for sure, whether you're going to do them or not. There's a couple great books, one by Paul Thomas, one by Bob Sears, that goes through all the ingredients in the alternatives, the alternative schedules, all of those sort of things if that's something that you're interested in. And then get a healthcare provider on your team, like a chiropractor, like a PT, like a holistic pediatrician, or OBGYN or midwife or doula that is able to give you the whole broad spectrum of choices and help put all these things together to help you process, because it's very difficult. So if you have any questions, post them in the comments. It's a 15-minute video. I was hoping for under 10, but I wanted to make sure I got through everything for you. So I hope this was helpful. Again, let me know if you have any questions or concerns. I'd be happy to answer them. All right, guys.